Good morning, everyone. Thank you for joining us today. As I record this, we've just reached the milestone of, I think, 15 million people being vaccinated against coronavirus, which is an incredible achievement, really. So really, we thought it was a good time to review all of the employment aspects of vaccinations, COVID testing in the workplace, and some health and safety updates. So hopefully a fairly short webinar, and what we've tried to do is keep this very practical, so giving you the information that you need to be able to review the situation in the workplace at the moment and make sure that you're putting in place the best protections that you can for your employees. We do have some additional resources available at the end of the session. You can find those in your registration page. And also, if you have questions, because this isn't a live webinar, it's best to just submit those to us directly when you finish watching. Those questions can come through either the general email that you're provided in your invitation, or to any of your usual Fatanity contacts, and we're happy to come back to you on those. So turning first to the question of vaccinations, there's been a lot of information on this in terms of different press reports and different sorts of commentary on what employers should and shouldn't do in relation to vaccinations. And now that we're reaching the point that vaccinations will become more available to the working age population, I think it's more important than ever that we look at this and think about what the options are for you as employers. So there's a balance here between the ethical and the legal considerations on what you need to think about as an employer in terms of what you will ask for in relation to vaccinations, and really that key question about whether you can compel employees or applicants, and we'll come on to recruitment later on, to have had the vaccination in order for you to be able to operate a safe workplace. This is a difficult balance, and there are ethical and legal considerations here. The government haven't yet said that they will make vaccinations mandatory, and it's unlikely that they will do so. It would be very unusual in terms of UK policy on vaccinations to make vaccinations mandatory. And of course, at the moment, we're still in the middle of rollout, so it's not as if everyone can access a vaccination at this point in time, although obviously the hope is they will be able to in the next few months. And depending on the sector you're in, it may be the case that your employees have already been able to have access to the vaccination if they chose to do so. So really there's this difficult balance between the individual rights of an employee to choose whether they have a vaccination, which is, in many ways a private matter for them, with the right to be safe at work. And for you, if you are leading on this in your workplace or contributing to the strategy on this, you will primarily be thinking about that employer duty to create a healthy and safe workplace for all your employees. And vaccines will definitely have a role within that. We don't know at this point in time, do we, as to whether vaccines do definitely prevent the transmission of coronavirus. And that's going to be one of the really important factors in terms of health and safety. As the data develops and there becomes more certainty on whether vaccines actually reduce the spread of coronavirus significantly, that will become one of the really relevant factors that you'll be thinking about in terms of protection in the workplace. But the starting point at the moment is that the individual still has the right to make that choice. And so you then need to think about your service users, other employees, the way in which your workplace is set up, as to how strongly at this point in time you would take forward any argument that the vaccine is mandatory, and we'll talk about that a bit further. So your policy, you may ask employees to confirm that they have been vaccinated. Again, as I say, I think that will develop in time. If you were to ask for that today, there will be a large number of employees that wouldn't be able to comply because the vaccine has not been made available to them yet, because they're not in a tier that allows them to have that vaccine. Although if you are in a certain sector where the vaccine has been made available to current employees, this may be a more reasonable request. Although thinking about obviously employees who don't currently work in the sector, they may not have had the ability to take up that vaccine yet. However, it may be that you're asking them to confirm to you that they will consent to being vaccinated. Now, raising that question in the recruitment stage does raise similar issues to those if you're raising it for current employees. There are various issues that they could raise in the legal context, in the employment context, in terms of potential discrimination. So again, if you're asking employees to change their terms and conditions, to agree perhaps contractually that they will have had or will have the vaccine when it's available, you do need to think about whether that is a proportionate approach to your workplace. If you are in a sector which is very high risk, perhaps the care sector or the travel sector that's directly engaged with people traveling from various different countries, and you want to think about being able to reassure those customers of their safety, then it may well certainly be more arguable to put forward a case to say that vaccine is reasonable request in that workplace than in a more average office or manufacturing environment, albeit that you as an employer may well decide that actually that is one of the best ways to keep employees safe. I think at this point in time there is that consideration as to how likely it is that you could establish that it was a genuine requirement of the workplace. Even if you can establish that it's absolutely a genuine requirement to ask employees to commit to having the vaccine, you still need to carry out those usual exceptional thoughts really around certain cases of employees. So there may be employees who have medical advice not to take the vaccine. I think those cases are likely to be unusual, but if they have actually had medical advice that it's not safe for them at the moment, and there certainly are those cases, then it would potentially be disability discrimination for you to compel them to have the vaccine against medical advice. The same for pregnant employees. Perhaps the employee isn't ready to tell you yet that she is pregnant, and she is telling you though that she is not having the vaccine, and you perhaps won't know the reason why. But if it is in relation to pregnancy, or even you may have seen in the guidance that if you are hoping to become pregnant or trying to become pregnant, that it may well be at this stage that vaccine is not recommended. Again, that's something that an employee probably may not share with their employer, but will want to say that they don't intend to have the vaccine. Religious belief is another area where we're seeing some commentary to say that employees are saying that's the reason why they don't intend to have the vaccine. And so you would, on a case-by-case basis, want to try to explore those reasons with an individual employee and decide whether it is acceptable for them to say that they will not have the vaccine. And this, of course, is going to be a very contentious area for you as the employers to substitute your view as to what's reasonable. So I think that it is just worth being aware that there are legal grounds on which an employee could challenge a blanket policy for vaccine. So any policy will need to include in it those individual considerations for employees to be able to approach you and make the case for them not having had the vaccine. So there needs to be that flexibility there. You would need, however, to balance that against the overriding duty to provide a safe and suitable working environment for employees and thinking about how they're protected from harm. So if a particular employee's refusal to have the vaccine does, in your view, place others at risk of harm, perhaps it's the service users in a caring environment, perhaps it's other colleagues, if it's really impossible to create social distancing in that workplace, you would need to think about whether actually you potentially would look at redeploying that particular employee or asking them to wear enhanced levels of PPE. So there are other steps that you might take to try to mitigate the fact that they're unable to have the vaccine at that point in time. So ensuring that everyone is vaccinated may not be the only mechanism, and we'll talk later on about risk assessments. It may be that if an employee does not have the vaccine, you need a plan B for what will keep others safe in that regard. But communication is really key. Our advice would be you don't want to be in a situation of arguing the legal basis for an employee having or not having the vaccine. Where you want to be is in a place where you've shared really good, clear, consistent, accurate information on the benefits of vaccination, particularly in relation to your workplace as you see it, what you see the benefits are. And particularly, again, if you're in a high risk sector, and it will help to protect others and to give confidence in the service that you and your employees are providing. So really clear information backed up with evidence where available, perhaps that's government evidence, medical evidence. You might, if it's really important in your workplace, consider engaging talks from professionals to encourage engagement of staff. So perhaps invite in a medical professional or engage in a webinar to try to provide further information to employees about the safety of the vaccine. And And there are really varying rates amongst the general population at the moment as to how people are feeling about whether they're comfortable to take the vaccine. So the more that you can do as an employer to educate people and to make the case for them being vaccinated where it's safe for them to have that vaccine is really important. And I think it's being careful here and considering the impact on staff morale. People feel really strongly about this issue, and some people, I think, will be very bold in their views as to everyone should have the vaccine. I think many of us absolutely see this as a way out of the current situation, and it probably is likely to be the way out of the current situation. So there might be some quite emotive language and feelings around vaccines, and if people are seen to be not complying or not agreeing to have the vaccine, will you get cases of grievances or other sort of issues arising? Also, if managers are particularly strong on this issue, it may be that there are issues that they don't know about with an employee, a disability that isn't obvious to them. Certainly, from my point of view, I think a lot about it. I sort of instinctively would say vaccines are absolutely the right way to go, and you'd be very persuasive around that. But I can think of someone in my family who's got a blood condition, which is an autoimmune condition, which there is some conflicting evidence about whether a vaccine would make that condition worse. And it's quite a serious condition where the platelets in the blood are basically destroyed as a sort of overreaction to things like vaccines. However, it's also a very serious condition if you do contract COVID. So there's a real balance there probably in relation to taking the vaccine. And so there might be certain employees who have those kind of considerations that you never even knew about, an invisible disability that they've never had to talk to you about before. So it will be about supporting those employees and steering them to take their own medical advice as to what's appropriate for them, and making sure that they don't suffer a detriment at the hands of other employees or managers who might take a dim view of their refusal. It's quite a private matter, and it's one that normally an employer wouldn't be engaged in, but of course we all are at the moment. So what to do now? What's the practical advice? Well, our advice is it is the primary purpose to look after the health and safety of employees and those who come into contact with them in the workplace. The vaccination programme is certainly a very effective way, we hope, of, as the data comes out, preventing the spread of coronavirus, but also of preventing employees from becoming very unwell themselves if they do contract coronavirus, particularly if that's likely to be in the workplace. It's obviously a good thing for a number of employees in the workplace to have been vaccinated. So I think that if you are in a position to put lots of support around a program that educates and communicates with people about this, that will be a good thing. Also making sure that it's very easy for people to attend their vaccination appointments and actually have their vaccination. So if that's happening during working time, perhaps you would include in your policy that you absolutely support that and that you would be giving them time off to have that vaccination. And thinking about if that vaccination cannot be undertaken, what alternative measures do you need to put in place to keep them safe? Thinking about what's your motivation for asking an employee to be vaccinated. We've covered this a bit before. If it's very sector specific and they're coming into contact with lots of people as part of their job, that may be more important. And also, though, social distancing, wearing masks and other measures might achieve the same aim of preventing the spread. So it might be that you can put in place measures that would balance out the risk of them not having the vaccine. But ultimately, those sort of human behaviour mitigating factors like wearing a mask or hand washing or social distancing, they obviously do have a failure rate because employees may not always remember to do them. And so ultimately the vaccine, it's explaining to people that is a very good tool for you as an employer to know probably what the risk factors are in the business if you're able to track how many employees have had the vaccine. So, and it may be the case that you actually want to lift restrictions at a certain point in time, and that could become part of the communication strategy with employees. I would urge caution on this at the moment. As I've said before, obviously we don't know the extent to which the vaccination programme will reduce or eliminate spread within the workplace. And so it's really important that you continue with all of the government health and safety guidance in the workplace at this point in time, as well as supporting the vaccination programme. So the question that's been asked several times already in the recent months is whether you could dismiss an employee who refuses to have the vaccination. In legal terms, yes, it could be a reasonable line management request to ask employees to have this vaccination, particularly if there are good reasons in terms of them coming into contact perhaps with other vulnerable people, and it could form the fair basis for a dismissal. The risks with this are going to be whether the employee has a particular characteristic they can rely upon, an underlying disability, a sex discrimination characteristic if this relates to pregnancy, that would mean that that potentially fair dismissal becomes unfair and becomes discriminatory. And in such cases, there may well be compensation awarded. You'd need to think very carefully as well about alternatives to dismissal. Is redeployment a possibility? Are there other alternatives that I've already talked about in terms of enhanced PPE? So I think dismissal as a sort of punitive action because the employee didn't fall into line, and we've got the case, haven't we, of Pimlico plumbers who've brought us all the joy on working time cases, saying that they will say that it's absolutely mandatory for all their employees to have the vaccine, and they will dismiss if employees don't have the vaccine. So there are certainly employers taking that hard line, but I would just urge some careful thought about if you are taking that line, why, and being able to evidence that well before taking any further steps. And then, of course, applying a very fair procedure so that it doesn't become just a knee-jerk reaction, that you would apply the normal procedure that you do in terms of allowing that employee to come to a hearing, to explain their reasons, and to look at all the alternatives to dismissal before making that decision. So it is an area to be cautious of. There will be employers who become the first test cases on this. I wouldn't want you to be one of those employers. On the other hand, you may have decided within the context that you work in, actually, this is absolutely crucial and central to the business, being able to make progress against the current restrictions. So it is a balancing act. So company vaccination schemes is another area that has been debated a little bit, and really this is more of an ethical than a legal question. At the moment, we're seeing in the UK, it's unlikely to be the case that companies at this stage will be involved in procuring vaccines themselves to give to their employees. As the years roll on and systems develop, we may see more of that. And certainly outside of the UK and other countries, employers are being asked to take a far greater role in providing vaccines directly to their employees. But I think here, at this point in time, because fortunately the national programme has been so successful to date, even if it was to be possible, I think if you were to explore this issue of the company providing the vaccine at this point in time, would there be a reputational issue around you as a business to be seen to be stockpiling unfairly? And there's the kind of CSR considerations of, if you are making this available to your employees and others in the community aren't able to access the vaccine, what does that mean for you as a business? So quite a tricky area, and at the moment I think it's one that isn't aligned to pursue at this point in time. But if you do have operations outside the UK, of course the picture there might be very different, where a different approach is being taken in terms of making the vaccine available to the general population. So also, just to look briefly at supply chain issues, if you have a very effective vaccination policy in the workplace, but you have a supply chain where suppliers are quite often perhaps on site with your employees, and that can't be avoided, or you're just looking in general at kind of the next step in your own policies, which involves also contact with suppliers, would it be right to require your suppliers to have ensured that all of their employees have had the vaccine? So I think this is an area that will develop, and as we see the availability of the vaccine widen and more people having that ability to be vaccinated, we will see requests potentially in tenders or other sort of supply chain management documentation, setting out provisions in relation to employers wanting to understand what other businesses have done to protect their own employees from coronavirus, and also how that interaction will work with their own business. But I think at this stage, it's probably a step too far, unless, again, you're in a very high-risk sector in a very specific context where it's really important to you to ensure this is the case. It may put your supplier in a difficult situation in terms of data protection and having to share certain sensitive data in relation to its employees. But you may well start to ask more robust questions around their risk assessments, what they have done to protect their employees and what they are doing to protect your employees, where there's interaction between the two. So I would encourage thinking about this supply chain issue and thinking about whether it does affect your business, and if so, what you may require them to do. For example, can you ask them to wear a certain level of enhanced PPE when they come to your workplace, perhaps to provide services on site to you? Yes, absolutely you can. You need to carry out that risk assessment for your own business and cascade that down through the supply chain. So just now to look briefly at workplace testing. So this has been quite an interesting area, and I know that a number of you have already been engaged in private workplace testing. And in recent weeks, this area has developed in terms of the government's offer of publicly funded workplace testing for certain employers. So we're just going to look briefly at what the issues are that you need to think about there, either if you haven't been doing it before and you're thinking about doing it now, or you are doing it and it's something you want to develop. So the latest update can be found, I provided the link there, and it'll be also available in relation to the materials following the webinar. So do have a look at that update to see what the latest guidance is. But basically, if you have more than 50, if you're registered in the UK and you have more than 50 employees who cannot work from home, so this remote working is still a really important part of the picture. For those of us that can enable remote working, that is still absolutely recommended and will keep people out of general circulation. So it really is still very, very much an important factor to consider. But if you have 50 or more people who cannot work from home, then the government will support by providing test kits. Now, it is important to note it is about the provision of test kits. There's still a lot that you would need to put in place as an employer to make that workplace testing safe and effective. For example, finding an appropriate location for the test to be carried out, making sure that the person who's carrying out the test is appropriately qualified and able to do so, making sure that all of the materials involved in the testing are stored safely and that the tests are processed in the right way. So quite a lot to think about there. Unfortunately, it's not the case that the government simply comes along and runs that programme for you entirely, but there is more support there. So do have a look at the guidance if that affects your business and think about whether that workplace testing would be a good thing. Ultimately, as we've said before, it is about making the workplace as safe as possible. Testing absolutely could provide a really important factor in that sort of safety consideration. So it's definitely one to look at. You could, if you don't fall within that public scheme, arrange for private testing of your employees, and that's absolutely fine. Again, all those other considerations would apply if you're going to ask people to undergo the testing in the workplace. Have you set it up appropriately and so on. So good communication strategy on this, including if you have recognised trade unions, I would absolutely encourage, absolutely ask that you would involve the health and safety representatives from the trade union in the discussions. What is the purpose of the workplace testing? How will you support if a test is positive? And how do these procedures keep others in the workplace safe? So it's that wider thinking rather than the knee-jerk, we're going to do the testing, what's the process around it? Employers are going to worry if they test positive, but they're not going to be entitled to perhaps company sick pay. So you need to think about what are the supportive measures you're going to take. If there's a positive test, how will you make sure that employee is not under pressure to come into the workplace? And so try to reduce transmission that way. Data protection is really important here in relation to workplace testing. Obviously, you're dealing with sensitive data, it's medical data in relation to test results. So the ICO has produced some really good guidance actually on data protection in general in relation to coronavirus testing and receiving people's private test results when they communicate that to you. Do have a look there. You should look specifically at your data protection procedures and be able to explain them clearly to employees in terms of the data that you're collecting, why you're collecting it. So do a data protection impact assessment and various other factors around how you're sharing and processing that data. So have a look at the ICO website, but we've got our own data team here and they can help you. You should have a workplace specific policy that you understand and that the data controllers and processes in your business really understand, so that you are protecting this information and keeping it secure. As I mentioned earlier, the practicalities of setting up need to be thought about, and dealing with refusal. So similar to an employee who says they don't want to have a coronavirus vaccine, there will definitely be cases of employees that are not comfortable with workplace testing. My advice on that would be to have one-to-one discussions with them and try to understand their concerns, because you might be able to allay their fears in terms of, is it a data issue they're worried about? Some employees are really uncomfortable about the physical process of the testing, and perhaps with them it is a case of working with them to to help them understand how much difference an effective testing scheme can make. If ultimately they continue to refuse, they may do so, they may say they're doing so on medical grounds. Actually, in practice, I've seen very few cases of employees being able to get medical exemptions to the testing. Certainly in relation to mask wearing and PPE, I've seen some sick certificates, well, some medical certificates about what other measures need to be taken because they can't wear the mask for various medical reasons. But I've seen very few certificates come through to say they can't undergo testing. But you may have cases where people are very worried about it. If so, you might want to consider, can they still work remotely? Are there other factors that you can put into place? Now, it might be appropriate to ask that employee to wear enhanced PPE compared to other employees because you're unable to test them. They might present a higher risk. So I think they do need to understand that if they're refusing to take part in the testing, you still need to then think about the knock-on impact to everyone else's health and safety. But it's important not to do that in a punitive way and to be supportive and just try to work with that individual employee. Overall, we're seeing really good compliance with workplace testing, that employees generally are agreeing to the processes once they're assured that it's being done in a safe way and in a professional way, and they understand how the information is being used. And if they're supported to take time off in the event of a positive test, by and large, these are really positive processes to put in place. So I'm just going to finish by briefly covering the wider sort of health and safety context. We talked about this some time ago. We did a specific webinar looking in depth at health and safety and data protection, and that webinar is still available if you want to watch that. I just thought it'd be a good time to do a short refresh on some of the things that we talked about there. So there is the continuing duty to manage health and safety risks. So you need to continue to review and update your risk assessments on a regular basis. I think from talking to clients that there is some fatigue around this, particularly if in light of the more recent lockdown, you have been working, your majority of your workforce have perhaps been working remotely for quite some time now. Is there still the appetite there to keep developing the systems and looking at risk assessments? But it is really important. The government sector specific guidance on this is updated frequently and has been updated recently. So do go to the website and check for updates that are relevant to your sector and follow the guidelines in how to carry out a risk assessment and which factors you need to think about. Now, if it's possible to continue remote working, that might be required for quite some time yet to reduce pressures on the workplace in terms of numbers of people in the workplace and your ability to social distance. So I think it is a case as we now come to this next stage of people having had the vaccine of working age, you may get numbers of them saying, I've had my vaccine, so I'll be back at work on Monday. Now, we still don't know for sure what the picture is in terms of transmission from people who've had the vaccine. It's looking really positive, isn't it? But we don't know for sure. So I think there might need to be quite a careful management at this stage of people's expectations. As we're going down through the age tiers as well, could there be generational issues where employees who have been vaccinated, where it is safer for them to return to work, are returning to work, and other employees are still working remotely and perhaps feeling isolated or not as involved as they otherwise would? So you've got this interesting intersection at this stage coming up about how you'll manage remote working with employees coming back to the office. And I think it's very much worth giving some thought to that and creating a communication strategy to explain to employees how you're going to implement various changes in this sort of middle ground period where people may feel that it's safe to return to work. And of course, fingers crossed, as schools start to go back, let's hope that happens, then that might increase the demand for employees who actually want to come back to the office. So is your office, have you done a risk assessment recently? Is it safe for people to return? When they do return, do they need any refreshers on the processes they still need to follow in terms of PPE and social distancing and what's safe in the workplace? Particularly if they've had the vaccine, they might be feeling quite gung-ho and happy to come back and get on with life as it was before, and you might need to just give a bit of caution to them about how they behave. You've seen this slide before if you've seen our other webinars. So this is about the physical risks. So just thinking where you have employees who are still remote working, that your risk assessments need to think about the physical risks of that remote working. It might be their workplace setup. So have you made available to them an online assessment tool so they can understand whether they are working safely from home? Are there any other physical risks that you need to think about that they might be encountering at the moment if they're not able to be in the workplace as normal? And mental health really important. We know lots of statistics here about how this pandemic has affected people very significantly in terms of the impact on their mental health. Home workers are lone workers. A number of your home workers, may be having very little social contact. And if they're quite young, it might be really quite some time until they're able to have the vaccine. So they'll continue to work from home. So what tools have you put in place for them to be included, involved, engaged? And as I said earlier, if others are beginning to return to the workplace, will that make them feel even more isolated? So how can you make sure that they're as involved as possible? How can you also make sure that the tools are there for them to report if they are feeling under pressure, under stress? There's some interesting statistics about remote workers actually working longer days, feeling unable to take breaks. So do you need to do a bit of a refresher on what your policies are for remote working, how you want people to take breaks? With the current restrictions on travel, I know a lot of people are building up lots of annual leave and just not taking it. And do you want to actually steer employees to take some time off, just so that they don't burn out at this difficult time? So I think there's sort of plenty to think about there still for supporting those who are working from home appropriately, and making sure that you can demonstrate that you've done all you can to think about them. They're out of sight, but they shouldn't be out of mind. And if your approach isn't working, perhaps if you were to do a survey and find that employees really are struggling, what can you do? Can you change employee behaviour? Can managers make more regular checks on people? Can you change your systems so that you can be made more aware if people are struggling in some way? Do you need to introduce some form of online or remote counselling just to support employees? Because let's hope we're at the final stages of what has been a very difficult time, but there's no doubt that some people are still really suffering and need support. And as I think other employees begin to return to the workplace, you could get this real sort of two-tier feeling. So quite a time for sort of raising the red flag, I think, about those who are still remote working and thinking about whether your business is doing enough to support them. The flip side of this, of course, will be employees that are really comfortable with remote working, have become comfortable with it, don't want to return to work, even if they've had the vaccine. I've come across a few cases of employees basically saying that they don't want the vaccine because they're still not comfortable, and it sort of seems to come down to they don't want to have the vaccine. They think that will allow them to continue remote working. So now is the time to start to formalise those formal policies. If there's going to be a permanent change to your workplace in terms of how much flexibility you will allow for remote working in future, now is the time to really formulate that and begin communicating it, because it will very much be on people's minds. And I think it will be too late to do that later in the year. So I think absolutely now is the time to communicate that. Be just aware that if you are saying to people what you are expecting is a return to the workplace and an end to remote working, you may receive formal flexible working requests for home working. And if you do, you need to follow really carefully the statutory procedure that's set out. It's if they make a statutory request, it's not a particularly easy procedure to follow, and it's one where you can unfortunately have compensation awarded against you if you just don't follow the letter of the procedure. So do think about, and do make sure your managers are thinking about whether they are actually beginning to receive formal flexible working requests that need dealing with in that formal way. So that's the end of our webinar today. I hope it's been helpful. We really wish as a team, and we talk all the time about what we'd love to do, is to just give you concrete answers, i.e. yes, you can dismiss if someone won't have the vaccine. No, you won't have a claim of discrimination. Yes, it's absolutely reasonable to do X, Y, or Z. The problem is we are still in a place where it's all developing. We haven't had cases on this yet. The policies are still developing. The impacts are still developing. But we are all the time as a team sitting and talking. We talk to our colleagues in health and safety and data protection, and we try to bring the information together and give you a really practical set of thoughts on this, and to give you some guidelines to follow. So I hope you found the webinar useful today. As soon as there are developments, if we see more certainty coming in these areas, we will follow up with more bulletins and webinars. If you don't currently receive our monthly bulletin and you'd like to, please let us know. We put a lot of work into it, and we try and bring you all of the latest updates in a really practical way. So if you don't currently receive that, let us know, and we'll certainly make it available to you. And for now, thank you for coming, and I hope it's been useful.